But guys, the phone number is 888-659-3727. We are doing a test. This particular talk will be, and these live broadcasts will be specifically for Joe Tillman's page and his followers, and also obviously followers of the Bald Truth. But what we want to do is we want to give you guys the opportunity to speak to Joe and to me if you want to speak to me about some of your specific questions that you actually post on YouTube and elsewhere. I know a lot of you guys try to contact us. A lot of you guys are contacting Joe. Joe has been kind enough to spend many hours of his life answering you guys back directly. Which is something that I did for many, many years and unfortunately do not have the time to do right now. But we figured we'd kill, two birds with one stone. If you guys have specific questions, you can be anonymous, and those questions may help others who are watching the live feed on YouTube.
And that's what this is going to be about. We've been doing the Bald Truth for I've been contributing on video for the past 5 years. I've been a part of the Bald Truth for how long now? What?
It's got to be over a decade.
Over a decade now. Gee, I never thought of that.
Oh man!
Holy smokes, man! But but we're trying something new. We're trying to utilize my audience and my YouTube channel. We're going to incorporate that into a new broadcast. Bald Truth is on every Tuesday. We're going to try to do this every Wednesday. That's the tentative idea right now, but we're not sure. And like I said a couple times already, this is simply a test. We're just testing out our equipment and our connection and making sure that we've got the all the details set up. So far, it's looking pretty good.
I have to. Well, first of all, I think it's important that you guys establish a time that is going to be most comfortable for your audience, your specific YouTube audience, to call in.
Yeah.
And speak to us. And, that is up to you guys. I'd rather not do it at 2 a.m, if possible.
If it's 2 for them, that's fine, but not for us.
Not for us, yeah.
No. We'll try to avoid that. We got some more viewers there. What do you think so far? Is it?
It looks good. I also think that we're going to be able to be, as candid as we are on the Bald Truth, I think we're going to have opportunities now to speak about more specifics that I think could really help a lot of guys.
Yeah, no, agreed. And how's the volume? How's my sound from this distance? Because I'm not leaning into the.
Well, on me, you sound. Hold on, let me turn off my headset and my mic, and you could just speak. And your delay is probably about 12 seconds for me on YouTube, so
yeah,
I'll check it out. Just start talking.
But anyway, yeah, we're excited about this. This is going to be a new opportunity for us, and I think what you're saying before is this will allow us to maybe address some subjects that we haven't addressed in the past. If we can have more direct interaction, not just through the phone calls, but through the chat service. But we want the phone calls. So anyone watching this, please do utilize the number that you see at the bottom of the screen there. We might. What do you think about putting both numbers on the lower third, the UK and North America?
Yeah, we can figure something out. It may take up a little bit of room. What we might do, what you might want to do, is in the description of the program, you can put all the numbers. We'll have the 800 number. The UK. Hold on. Europe can get through. It's an international toll-free number, but we made it easier for people who are in Europe to call the UK number as well, because there's a lot of guys who wanted to do that. They're not being charged long distance through their carriers, so if they're in another a country in Europe, they're able to call the UK number, and it doesn't cost them anything either.
And a lot of people use Skype to call, so they can they can call any number that we have up on the screen.
Right. And what I think we can do, if you want, is that we could pop people up via Skype. So if people are willing to show their faces, as long as there's no, no anything below the waist, we'll pop you up.
Like us.
There would be, I'm sure there'd be plenty of guys who'd want to do that to you.
What was it Chevy Chase used to say on SNL update? Hi, I'm Chevy Chase, and I'm not wearing any pants.
Right.
Or something like that. Yeah,
Exactly.
because you can't see with the anyway. Yeah. All
And
right. So
is there anybody that's watching that wants to call us? Call Joe. Ask a question. Something you've been, thinking about. While we're testing now. Let's give the phones a shot as well.
yeah, put the number out there again.
Yeah. Let me put up this. I mean, do you see where they're listening from?
No.
All right. There's a phone number 888-659-3727.
I'm looking for.
I didn't train today because of you. I have to go to the gym still.
Because of me.
Well, because I got up at 8 o'clock instead of 6. And so I slept in.
He slept in.
8 o'clock is sleeping in for me.
Here we go. No. Okay, I found a new settings area for me. Interesting. I'm just looking at the options I have for chats.
All right, so I'm going to put the camera on you. I'm going to get a cup of coffee. If, this is your gig, so if people want to call you, when I come back, they'll be on hold, and I'll open up the line.
Okay. Yeah, just check out the settings. So for those of you that may not be aware of who I am Joe Tillman, the original hair transplant mentor, and I started out in the hair transplant industry over 15 years ago, and I'd been a patient for much longer than that. I had my first hair transplant in 1992. I'm currently 47. It was, Jesus, wait a minute. Was that, hold on, I gotta do some quick math. That was, oh my God, that was a long time ago. That was 25 years ago. Jesus Christ. I had my first hair transplant 25 years ago. I was 22 years old. And then I had a second procedure in the same year. I think it was the same year. And yeah, it was not a great experience. Neither one of them were. I wound up losing all of my hair through the next several years. And throughout my 20s, I was bald and I had a pluggy transplanted hairline. That was fun. And it wasn't until I was 31 years old that I got my first repair procedure done. And that changed everything for me. I looked natural, but more importantly, for me anyway, I found a passion. And that passion was to help people that were in the same situation as me. And because of this, I was the first person to really blog in near real time and document what it's like to go through a hair transplant, not just to show before and after photos, but to also really document as it happened what I was going through. I was showing photos of the development at 3 weeks, 4 weeks, 3 months, 4 months, the whole 9 yards in different locations. When I was on my boat on Lake Washington in Seattle, or when I was on the Space Needle, or when I was with friends, and just random casual photos that were showing the various stages of my hair after the different procedures, because I did wind up having multiple procedures, 9 in total. And I went up working in the industry, and that was 15 years ago. I got into the industry as a professional, and I've been loving it ever since. And what I'm doing now is, as the hair transplant mentor, I have my website that is seen by thousands and tens of thousands of people every month, where they're able to read real information that I put out there, as far as simple things like terms and definitions. If you don't know what a certain term or definition is when you're reading and researching about hair restoration, you can go to my website and see what it means. It's I got over 100 terms and definitions, the most comprehensive on the web. And so far, it's a big success, and I hope that you can get some benefit from it. And with my YouTube channel here, it's been growing like crazy. I've had it since I think 2006, but only in the past year have I gotten serious about it. And since then, my videos have been exploding. I've been trying to stay on a regular schedule, but man, it is tough because I put a lot of effort into the production because I want it to be fun. I want it to be humorous at times. I want it to have a nice production value, and it's all free, guys. I don't charge you a cent for it, so I hope you're able to get something from it. While we're here, like I said, we are testing this, and you're more than welcome to call the number on the screen. If you're not in North America, you can use Skype or something to call the number as well.
Not easy, is it?
Huh?
It's not easy, is it?
What are you talking about? I've been here talking.
Dude, I was watching you. I went to the kitchen here at our office at TBT Studios, made some coffee, watched you online, and I think you were doing a really good job. So I'm just busting.
Well,
your
thank
balls.
you. Thank you very much.
And your video looks good. And now your sound is fixed.
Yes, so I think we're good to go. But like I was saying, anyone that wants to call in, we're going to be on for another few minutes and testing this out. So
Guys,
yeah.
Joe wants to test this out. Give us a call, 888-659-3727. This is not an official time for a show. We are doing a test. We want to make sure that all components of this system is working. And you have an opportunity now, if you've been following Joe for a while, to give him a call. If you don't know who I am, the unshowered guy in a hat, I'm just a guy who wrote a book about hair loss. Let's put it that way. That's it. Founder of the American Hair Loss Association, founder of the International Alliance of Hair Restoration Surgeons. Yes, that book happens to be the most read volume on the treatment and the prevention of hair loss in the world. Big deal. It is what it is. And but we're here to provide you guys with the truth. And Joe has been, I think, doing a very unique job as far as the way that he's been presenting his video content online. No one has really done it, in my view, in such a kind of an entertaining, non-salesy type of a way. He's just giving you the truth the way that he knows it, as a guy in the trenches for a very long time. And as a guy who's worked in this industry for forever. I met Joe at least online and over the phone many years ago. He didn't like me. No, I'm just kidding. And
No, I did.
yeah. No, I mean, I think at the time it was kind of like, okay, this is Spencer Coburn. He's the guy doing the show. He's the guy that my bosses are working with, and we just had this relationship that way, which turned into a relationship that I believe really has benefited. I know has benefited hundreds of thousands, if not possibly millions of people over the last decade. We get emails all the time, and the guy who called a live show yesterday.
Yeah, exactly.
It was actually, a guy who is a real hair transplant veteran, a guy close to my age. He's 50. I'm 52. I still feel like when I hear 50, that is old, and I'm older than that. But this guy, has been a long-time listener and viewer, I guess, of the program.
Awesome. Yeah.
And he said it that, initially he didn't know how the dynamic would work with me and Joe, having Joe as my main contributor, my co-host, my sidekick, my man on The Bald Truth. And this is a guy who's been listening for many, many years, probably, I don't know. I think he said he was an original, like an OG listener. I don't know.
I think he said he was, yeah.
He may have been listening on the radio. And he said it works because the dynamic is so different. I have never had a hair transplant. I've avoided having hair transplants because I understand what, not being a candidate really is and what that means to the future of my hair loss journey. And if I were to have a hair transplant, because of the amount of hair that I have, I really believe that I have a significant chance of shock loss. So I'm willing to dummy up my hair, to spray it to the point where it does not move in the wind. It's essentially bulletproof. To paint the back of my bald spot because I've saved a lot of hair, and I feel very fortunate. I don't want to, even though I know, if all the stars are aligned and I have the right procedure, I can live much more freely with being able to comb my hair straight back. And I still probably would paint my bald spot because I don't think I would want to use the grafts in the crown, even at 52. But I can definitely wouldn't mind lowering my hairline to the point where I can comb it straight back again, and feel like my forehead isn't a 7 head. But
And
I do not do that.
and that would be a safe direction to move in. I was just sorry, I got distracted. Ricky Quaresma
Oh, my eyes look swollen today. Go
in
ahead.
Germany,
Yeah.
in Berlin. You can call in, Ricky. You can use Skype. I know you got Skype. You're German. All Germans use Skype. I think it's given to you as from birth. Call the number. We can take the call. But to answer your question, he
Let me
says
put the European number up just so he can call. He can call that 0203-3734-683. He's probably not even charged by his carrier to call other parts of Europe. At least
probably,
that's kind
yeah.
of the way it works here in the U.S.
He says, watching from Germany in Berlin, I'm 22 years old and started losing hair at the age of 21, mainly on the crown. His doctor prescribed finasteride 5 milligram, and he says, I'm taking it every second day since January, but don't have results yet. My main question is, does blood flow and nutrition play a big role in male pattern baldness? Sorry for my grammar. My English isn't the best. Well, it seems just fine to me. Um, blood flow and nutrition. Blood flow and nutrition, they go hand in hand, but blood flow is a big part of it because without blood flow, you don't have the nutrition that is carried to the follicles so they can thrive. Um, so, I mean, this doesn't really apply to your finasteride use, but it's anecdotal. I mean, there are no studies out there that I'm aware of, but I'm a believer in making sure that your nutrition is optimal. And if your nutrition's optimal, and this involves also the use of keeping internal inflammation down, which is something a lot of people aren't aware of. It comes from eating foods that you might have a mild problem eating that you might not be aware of. But if you can keep your inflammation down, if you're eating nutritiously, then then everything else will click and your hair will be the best it will be. And just an example is several years ago, I started really watching what I'm eating. And I actually started eating just meats and vegetables, and I was avoiding carbohydrates as much as possible. I cut sugar out probably 99%. And in a matter of weeks, not only was I feeling better, but my hair started to behave better. I can't say that it grew more hair or that my hair thickened, but it did seem to be stronger overall. It did seem to be healthier and I guess poofier, I guess, if that makes sense. And I do believe that nutrition had a role to play in that. Blood flow, that does play a role because we know how minoxidil, Rogaine, works. It helps to open up blood vessels. It's the vasodilator, increases blood flow to the areas of the scalp where you need it, and that's why you get growth, or sometimes you get growth or fullness from minoxidil for some people. So, I mean, there is a role that it plays. How much we can't say, but I do believe it influences it.
Look, when I wrote the first Bald Truth, I wrote an entire chapter on diet and hair loss. And Barry Sears, who is the creator of the Zone Diet, who's a well-known PhD, and a guy who really believes in the areas of issues of insulin resistance and, like you said, Joe, inflammation. He wrote a page, a little bit more of a page for my book, basically stating that my hypothesis was correct, and that eating a relatively low glycemic index diet that also helps with inflammatory issues can help with the conversion of testosterone and DHT, meaning that it could help to diminish some of the effects of that conversion. And I don't know for sure. I definitely know that when I am eating really clean, when I'm training, I've gone up and down. You guys have seen me on videos for a year. I'm at my all-time low now for my age at 179 pounds. My high was probably 210 pounds. I look like an old wrestler with my shirt off at that point. But I definitely notice that when I am eating better, when I'm training, when I'm not really drinking, which I love to do, as anyone who watches just the Ball of Truth knows, my hair in general seems to be fuller, easier to manage, and I noticed that I even have to use less Durmatch on the back, probably because the hair shaft diameter is slightly better as it's growing in. And, just all those small changes have made a difference. Do I believe that it's going to stop the progression of your hair loss or regrow hair? Even though Barry Sears said that he thinks that that's a possibility, I don't. I definitely think if your genetics are really strong, then what you need to do is do everything you possibly can, including diet, to help manage or mitigate the damage caused by your genetics that can be caused by your genetics. And I think diet absolutely plays a role. But finasteride works. That's all I'm going to tell you. I've been on it for a very long time. For most people, they have good results with it. And I think Joe is an example of that. He doesn't, his entire top of his scalp is transplanted, and he still uses it because he wants to maintain the donor area that was used to be put on the top of his head.
I don't want the sides to drop and create these large gaps. I mean, I already have a gap in my part line, but I don't want it to get worse. So that's why I take that.
Yeah. And that's why, look, I'm wearing a hat today. I did not do my hair. I was working all morning, and I did not take the time to dummy up my hair. This is how I live my life. I take this shit off. It is just like hairsprayed hair stuck to my head. It's ridiculous. But I do feel very fortunate that I'll be 53 in like 6 months or so. I mean, I'm an old dude. That's just the way it is. And
48 next month.
Yeah. And I'll be, I've lived my entire life, starting at the age of 21, dealing with hair loss with what appears to be a full-looking head of hair. Now, there were times when it looked worse than others. There were times when it's like, I was like, why did I even try to wear my hair that way? I was cutting my hair myself for years because I was too ashamed to go to a barber very early on when I was like between 20, I'd say, and 26 or 27. So for a while, it was just like, I looked like a beetle, but, whatever. But, you're a young guy. And Joe, I hope it's okay. I'm just so used to fucking just commandeering the show. You got to start doing more of this. I apologize. This is your channel.
No. You're on a roll, man.
Yeah.
Not a problem. I do want to jump into a couple more questions that we got on the chat here. We've got Rory says, "Hi Joe and Spencer. I know in one of your first videos you say do not get a hair transplant. Is this something you really advise, or is a hair transplant a good idea for the right candidate? The latter, not the former." It's a good idea if you're a right candidate, but only, well, no, let me back up. No, don't get a hair transplant if you, number one, can live without having a hair transplant. And number two, if you haven't really considered the possible downsides of having a hair transplant. And that's what that video is about. Mainly is if you haven't really thought through the potential downsides, and there are many potential downsides and serious downsides, then don't have a hair transplant until you have considered those issues. If you do get to the point where you understand those issues, where you've talked to people even that have had bad outcomes, and you decide that it's worth trying, then you can move forward with your research and consider having a hair transplant. But always, 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 always consider not having a hair transplant, because that's the only guarantee that you'll ever have of not getting fucked up by a hair transplant. I've seen it happen too many times. And even when you go to the best clinic on the planet, whoever that clinic may be for you, and there is no single best clinic, they all have their screw ups. I don't care what they tell you. I don't care who they are. Even if they're people I work with, if they tell you that they don't have unhappy patients, they're lying to you, because every clinic has unhappy patients. And that's the whole gist of that video. If you haven't thought of the downsides, then don't have a hair transplant. I can't stress it enough. I've been saying it for forever. Spencer's been saying it forever. It is the dominant theme with everything I do, not just in the videos, but also with conversations that I have with patients on a daily basis.
And I think that's a really important point to make, that is the dominant theme. There are those out there who believe that for some reason you and I are out there selling hair transplants, when in fact my message has always been from the very beginning of my career that surgery is a last resort. If you choose to have a hair transplant, I founded an organization that I believe provides you with the safest place to start to do your research on physicians who are doing consistent work. That's it. That's all it is. I can't talk anybody, in most cases, out of having a hair transplant. There are times when we have, and guys call in, and I know one guy who's just a well-known caller to the show is Vic from D.C. It's Vic, right? Yeah, Vic from D.C.,
Yeah.
who was a young guy, was really enamored by what he saw online when it came to follicular unit extraction hair transplants. Guy who wore his hair short, thought that he would kind of just do a dusting, create a hairline, and live his life with a short haircut and a hair transplant, spending what would have been tens of thousands of dollars to have that done. And after speaking to him at length and realizing what his unrealistic expectations were, I talked him out of having a hair transplant over several weeks or months of him actually calling in. And now he calls the show to thank us and to thank me for talking him out of a hair transplant, because as he got older, he realized he doesn't want one. He doesn't need one. He's able to live his life and feel good and comfortable in his own skin. And the complications, given the donor area that he described and given his unrealistic expectations, not just the the surgical or physical complications that could have arisen, but the emotional complications to his life and to his well-being, would have been, in my view, for a guy like him, absolutely devastating.
Agreed.
So that's really what we're here to do. And, for a while there were physicians out there, and there still are, who don't understand what we do, who are like, well, wait a second. We want to be on your websites. We want to be part of what you do because we perform hair transplants, and you're trying to talk people out of having hair transplants. And my philosophy is, in the end, even if I try to talk someone out of having a hair transplant, maybe 1 out of 10 won't have one. The other guys will go and find someone to do the surgery. So you know what? They might as well go to you guys, because at least you guys are doing consistent work.
And my position is, if through all the education I'm doing through my videos, if you still decide that you want to have a hair transplant and you have followed my videos and you've listened to me and you've learned from me, then you will at least be a better candidate, because you will understand that you are taking a risk. You won't go in expecting perfection. You won't go in expecting 100% yield, which is what we're going to refer to with Dylan Barnum's question. You'll be in a better position to understand the downsides and potential downsides of what you're getting involved in. That's the goal of that for me. I want you to be a better candidate if you do have a hair transplant to begin with. And with what Dylan's asking, he says, I have a clinic in Chicago that's telling me they have 100% hair growth from all the grafts transplanted. and they only do FUE too. Yes, they're lying to you, because you need to ask them a very specific question. You're telling me that you get 100% growth. How do you measure that growth? How do you measure and quantify that 100%? I'd like to see the paperwork. I'd like to see the studies that you've done. I'd like to see how you measure this. And they won't be able to answer you. They'll just sit there and they'll be like, what?
Yeah, I mean, it is absolutely impossible to measure that, first of all, unless they would have to be macro images of specific areas that would then have to be followed throughout the months, month by month by month by month. And then they would have to
Most
take
clinics don't do that.
they would have to take measurements in square centimeters of every area that was transplanted with separate macro images. It doesn't happen, okay? There is no 100% growth rate in any hair transplant. It does not happen. Now, are there great estimates, close estimates? Does it look like, okay, well, I implanted or transplanted and implanted, say, just as a round figure, 30 grafts per square centimeter. And if they can look at certain square centimeters which were completely bald at one point and then count, or even you can eyeball it to some degree, they may say, we got a 95% growth rate. That's still inaccurate, but you would be able to tell based on coverage, and a real expert can tell based on, volume and coverage, an estimate of how much grew. So Joe's 100% right. It's complete bullshit. No one can say they have a 100% growth rate. And if they say that they guarantee the results, essentially what they're doing is they're selling you a guaranteed piece of shit, in my view.
Well said.
Well said. That's the way. You can't guarantee results because what are you going to guarantee? And if they mean, here's what I say. If they say, look, if you're unhappy, we guarantee you a refund, that's fair. But they can't guarantee your hair to grow. They can't guarantee the results. And if they say they're going to replace your grafts, they can't replace your grafts. Your grafts are fucking gone. They're dead. All they can do is give you put more in and utilize more of your precious donor area. That's the only guarantee that they can give you.
Yeah.
So if someone says we have a 100% growth rate, you move on to the next clinic.
Dylan says they claim it's due to a lack of trauma, and I'm young too, so I know strip is better suited for me as FUE can damage donor hair for possible future procedures. Yeah, I mean, but here's the thing. It's like the, lack of trauma of the grafts. That's what they're claiming. But, I mean, look, I'm a huge fan of FUE, and I believe in it. But the fact remains that there is more physical trauma to the graft because you are handling each and every graft as they're being extracted or for the extraction out of the donor zone. It's just common sense. The difference, lies between, from clinic to clinic in how they do extract those grafts. In other words, how delicate are they and what kind of understanding do they have of the physiology of the grafts so they know they can't just go in and start ripping them out blindly. I mean, it is a blind procedure by nature, but physically, it is more traumatic for the grafts. Does that mean that the grafts are going to die? No, because the grafts can sustain a certain level of trauma before they are permanently damaged. Trauma doesn't mean damage. It just means, it's being tested. It's being stressed out more than a graft that's not being traumatized. Strip is safer as far as reduced trauma, but then you have your issues with strip as well. So, and you said that you're better suited for strip because you're younger. That may or may not be true. It depends on how young you are. Depends on your hair loss. Depends on your family history and your genetics. What we can determine will be your final or roughly your final endpoint with your hair loss. There's no blanket answer which procedure is best for younger patients. It is highly individualized. So your thinking is along the right lines, but without more details and photos and stuff like that, I can't really get into your case specifically. But the trauma issue, you're absolutely correct, or your ha-ha tells me that you understand it. But yeah, them telling you that there is less trauma to the grafts, no, that's horseshit.
Yeah, I would have to certainly agree with what Joe said, and I would go even further. I take an even stronger stance when it comes to the trauma of FUE. I introduced FUE to North America through Ray Woods back in 1999. Biggest proponent out there. Even a guy who now claims to be the pioneer in the U.S. has written in the past that I was the biggest proponent, and I essentially introduced it to the world, or at least North America. With that said, and that's not to pat myself on the back, I still believe that when you are dissecting grafts in a three-dimensional fashion using microscopes, once that tissue is taken out of the body, the trauma level can be and is significantly less. And Joe's right in stating that, well, the trauma from FUE may or may not, or probably won't damage the grafts. You'd be surprised at how much pulling has to be done sometimes to remove that tissue after the graft is dissected using a punch or any type of a punch instrument. Sometimes it's removed using suction. Sometimes it's removed just by technicians using forceps. It really depends on the person who's doing it, and it depends on the how fragile your particular tissue and grafts are. It's not one size fits all. That's what people have to understand. So I personally believe that there is less overall trauma and probably a greater growth rate with a strip. However, you're trading that off for a scar in the back of your head and also the possible complications of being cut that way. Nerve damage. Sometimes that nerve damage can be permanent. Joe is completely right about further progression of your hair loss as a young person. Will that scar eventually become visible and become something that really disturbs you and affects your life? There's so many factors that are involved with both procedures. Hair transplantation is an imperfect cosmetic surgery, as most are, but it is probably the most, I think, difficult form of cosmetic surgery for people to be 100% happy with over a lifetime.
Well said. Yeah, no, I agree with that because there's so many variables that you're dealing with that you don't deal with other types of cosmetic surgery like rhinoplasty or breast augmentation. You're dealing with thousands of hairs that have to go in just the right way, and they all, they have to have a majority survival rate for it to be worthwhile. And we got Tuan Hung Vo says, what are the downsides of having a hair transplant? Well, Spencer just mentioned a couple of them. With strip surgery, you've got the potential for permanent numbness. You've got the scarring that you have to contend with. There are no guarantees with donor scars from strip. They can stretch. They can become wide. They can become tender, painful. Excuse me just a second. Painful. You can have permanent numbness. I think I said that. Sorry, I'm being distracted. But even with FUE, you can have premature donor thinning. You can have even patterns of extractions that stand out to the naked eye, to where if too many grafts are taken out from a specific area or too small of an area, then that particular area of your donor area can be very thin and noticeable to those around you. Not to mention, any issues with the growth from a procedure as well may not be to your satisfaction, and that's just scratching the surface. But overall, I mean, the downsides are, let's see, the downsides can be psychological as well, to where you may not be completely happy with the result, and it just bugs the living shit out of you to where you can't even function. I've seen it happen before. That's another reason why I always recommend people consider not having a hair transplant before they actually go through with it, because they may not understand what they're getting into. And this is going to be subject of a video I'm going to put together. It might be my next video on the types of people that shouldn't have a hair transplant. And one of those would be if you are a little bit OCD, obsessive compulsive disorder, you shouldn't have a hair transplant because you might become obsessed with little details that that other people wouldn't really even notice.
If you are still living at home, you probably shouldn't have a hair transplant.
Yeah, yeah. There's a long list coming.
Yeah.
If you have to bring your parents to a consultation, you probably shouldn't have a hair transplant. Things like that. It's a long list, so it'll be a good video. And let's see. Okay, quick final question, then we have to wrap it up because we got some other things to do today. But Ricky says, I would like to ask a second question. Can depression or anxiety disorder influence my hair loss or the inflammation of the scalp? I'm also struggling with inflammation in the crown area. Anxiety disorders can influence hair loss to a degree, and I think it has to do with, when you have anxieties, you have an increase in cortisol production, and cortisol can be the beginning of a list of issues that can cascade internally. You don't heal as well when you have elevated cortisol levels. I'm not sure, Spencer. What do you know of cortisol and how it affects hair loss? Because I know cortisol would be like the main component that we'd be dealing
Well,
with.
I can tell you that it affects just about every aspect of inflammatory issues and issues of your body. I mean,
Yeah.
cortisol and anxiety. I know someone who has. I have some anxiety, but I know someone who has pretty significant anxiety disorders who will, in front of my eyes, start to swell,
Yeah.
facial wise, and actually turn red and get blotchy.
Yeah.
That is happening all over the person's scalp as well. So there's no doubt that someone who has extreme levels of anxiety, and whether it's post-traumatic stress disorder or just general social anxiety or anxiety caused by hair loss that then turns into a social anxiety, there's no doubt in my mind that it also restricts blood flow to
Yeah.
certain parts of your body. So absolutely, 100%, it can affect your hair loss. It could affect also, I believe, medications that you're taking, and just the way your body functions in general. Again, we both have to preface this by saying that we are not physicians.
Exactly.
But when you live in this life and have been doing what we've been doing for so long, and also know people in your personal life with severe social anxieties and other disorders that manifest cortisol and other potentially harmful hormones, when you can see it visibly happening, you can imagine what's happening to people on a daily basis who deal with these types of issues. So, 100%, there's no doubt
And
that I think it affects people.
one thing I would encourage you to do is to start doing some research on Google. Look up or type in cortisol, cortisol, inflammation, hair loss. Put those types of search terms in and see what you come up with. I think you'll find some really valuable information. With that said, we're going to wrap it up. This has just been a test run for a future endeavor that Spencer and I are going to be putting together. I believe it'll be on Wednesdays, every Wednesday. We haven't come up with a time yet, but there will be an announcement officially that I'll put on the channel. And be sure to subscribe. I want to see my subscriptions go up while you're on, or while we're on the air right now, because when you subscribe, you'll get notifications of when we're live next. And you'll also get a notification of the announcement that I'm going to put up so that you can tune in and you can ask these questions in the chat, and you can call in to the Bald Truth on the number that will be on the screen. So that said, I'm Joe Tillman, the original hair transplant mentor, here with Spencer Coburn of the Bald Truth. And this has been a lot of fun. What do you think, Spencer? You think this worked out well?
I hated it. I absolutely
hated
it.
it.
No, I think it's great. I'm glad that guys are taking the time to ask questions in the chat. I think it's going to be more fun for people if they have the ability, to call in as well, so that the guys who are watching the show can listen, ask questions in the chat, and you can kind of go back and forth, because you're going to be heading this project, answering questions that are being asked to you and asked to us in the chat. So. Yeah, I think it's going to be good. I'm excited about it, and I like the idea of being able to even have a broader reach in a different way to more hair loss sufferers who need our help.
Right on. All right. Well, thanks everyone for tuning in and helping us out with the test. Spence, thanks for setting things up. It's been fun. And we'll make the announcement soon.
All right,
Take care.
guys. Take care.